Welcome to Hope Natural Health, the podcast inspiring you to be your best version. Join me, your host, Dr. Erin, naturopathic doctor, dog mom, cancer survivor, and girl boss weekly as we discuss all things health, hormones, and happiness with a little side of this thing called life. Welcome back to the Hope Natural Health podcast, where I try to get you healthy the right way. Last week, we had a special guest here, Clarita Escalante, and we talked all about the benefits of journaling. This one you don't want to miss. If you are thinking about journaling, want to journal, don't know where to start with journaling, it's wonderful. And she tells her story too, so make sure you go back and listen to that. This week, we're going to switch it up. We're going to talk more period stuff. So I want to talk a little bit about irregular cycles. I have seen this a lot in practice lately, and I wanted to talk a little bit about the reasons why we might have an irregular cycle. So do you even know if your cycle is irregular or not? And that's where tracking your cycle is super important. And a few episodes back, I did talk about 3 reasons why you should track your cycle. And I have the new period productivity planner out that can help you do just that. So go back and listen to that episode and let me know if you track your cycles and where you might struggle with that. But we won't know if it's irregular or not unless we track. And that's, super important. So the average length of a menstrual cycle is really anywhere from 28 to 32 days. Anything outside of that is really considered abnormal. However, we want to be consistent within that 28 to 32 days. So if you're having a period that is 26 days and then another one that's 35 days and then another one that's 43 days and then maybe you're back to 28, this is also considered irregular. So it needs to be regular and consistent for you, whatever that time is or that length of time is within that 28 to 32 days. So for instance, a patient of mine recently had she's anywhere from 45 to 60 something days. So this is definitely not a regular cycle because one, it's way too long. You should not be having 40, 50, 60 day cycle lengths. So here's a few reasons on why you might have an irregular cycle. So I am going to tell you a little bit about what happened to me recently and reasons why I had an irregular cycle. So I am approaching the perimenopausal years, but my cycle has been very, very consistent, 28, 29 days for literally my entire life. So when I have an abnormal cycle, I don't freak out and expect the worst case scenario. I sit there and try and figure out why am I having an irregular cycle. So a couple years ago in 2020, I had a super, super duper long cycle, 43-day length cycle, which is not normal for me. Well, what happened was COVID. And then I had, I believe at that time was when I figured out my thyroid was not being managed right. And I actually had Hashimoto's thyroiditis, which definitely played a role in my cycle length. So that is one cause. It could be an underactive thyroid. So anytime a woman comes into clinic and they have an irregular cycle, I'm always looking at the thyroid. I'm going to look at the thyroid anyways, but this is definitely a reason why your period could be irregular. And then second, in this last month, I had a 38-day cycle. And the only thing that changed, there was 2 things. One, I went through a little bit of stress and trauma. I had to put down my little Heidi Babes. So that was very traumatic for me. She was 16 years old and with me almost half my life. So it's super, distraught about that. So grief can definitely play a role in our hormones and our cycle length. And then 2, I was doing a challenge at my gym and really watching my calories and really watching what I was eating. So I drastically changed my diet for the good, but I also cut a little bit as far as my calories. So two more reasons. 1, stress, and 2, under eating can definitely play a role in the cycle length. So rather than sitting there stressing out about where's my cycle? Oh my God, could I possibly be pregnant? I just trusted that this was what my body was going through because I did something out of the norm. I've also heard from patients I had the worst cycle after I came back from vacation. This can also play a role is because your body is out of tune from its routine. You are eating probably things that you normally aren't accustomed to, more inflammatory foods. You might not be hydrated enough. Your sleep is out of whack. Maybe you went to a different time zone. All of that can play a role in an irregular cycle too. And when we have cycles that are consistently irregular, we're looking more at those hormone imbalances. But if you have a one-off cycle that's irregular, we're looking at what happened that previous month or maybe the month or two prior to that, that could have contributed to this cycle. So sleep is super important for our menstrual health. If we're not getting enough sleep, this is definitely going to impact and make a difference in the, the regular or irregular part of the cycle. Stress, as I mentioned, is literally probably one of the most common and underlying causes of an irregular cycle. Diet, if we're not eating enough, so under eating is definitely plays a role in our hormones, because if we don't eat, we can't make hormones. So we need to make sure that we're getting a good calorie count in and the right balance of that, with protein, carbs, mainly from vegetables and beans, and then good fiber from that. If we're eating the vegetables and beans, and good healthy fats that can support our hormones. Back to the thyroid. If the thyroid is underactive, this is definitely going to be playing a role in our menstrual health. Your thyroid plays a role in every single organ system in the body. So making sure that the thyroid is balanced and operating, effectively is definitely key. As I mentioned, hormone imbalances are another common cause. If we're not ovulating, it's definitely going to be playing a role in the cycle length or maybe the absence of the cycle. So we're looking at the why. Why are we not having a regular cycle? Why is it so all over the place? So the best way to figure out why we have the irregular cycle is to test. So we want to look at those hormones. We want to look at inflammation. We want to look at the thyroid. We want to look at nutrients that support our hormones. We want to look at cholesterol. All of these things play a role in our menstrual health. But first we need to make sure we understand if we're regular or not. And that's where planning and, tracking your cycles is important. So as I mentioned earlier, my period productivity planner is out. So we'll link to purchase it on Amazon below. And if you haven't tracked, I would start with that. And it also teaches you how to use your hormones for you. So I highly recommend you check that out. And if you have an irregular cycle, let's get you tested. Go to your doctor, ask for hormone testing, reach out to me. I'd be happy to guide you in that direction. I can help virtually, but we really just need to first understand if we have a regular cycle or not. So I hope this episode was beneficial for you, and I look forward to seeing you all next week.